unhealthy things. So what has to be done is that we have to modify our lifestyles to see that we exercise enough. A recommended exercise regime is to do walking 30 to 40 minutes per day for at least 5 days in a week. It need not be jogging or running. Simple walking is enough. Keep your weight down. Don't be obese, and then we can see that the incidence of heart disease can come down if we control all these risk factors. What is coronary artery disease? For the heart to function in a healthy way, it has to receive adequate amount of blood, and this it does by way of 3 tubes that run on the surface of the heart. These are called the coronary arteries. As long as the tubes are clean and blood flows through them properly, then the heart will function nicely. But because of the risk factors that we have talked about, like diabetes, hypertension, smoking, obesity, sedentary lifestyle, the blockages start developing inside the coronary arteries, and then the problem starts, and this can lead to severe problems if it is undetected. So how can we detect early coronary artery disease? If you're undergoing routine tests, we can diagnose coronary artery disease at an early stage. When you first visit a doctor for routine test, he will order for you tests like blood sugar and lipid profile, which include cholesterol to know bad cholesterol, triglycerides and other things which are detrimental to the heart. Having done the blood test, there are a few other tests which are important in diagnosing coronary artery disease. For example, the echocardiography will show us whether the heart is functioning properly or not. It will show us the power of the heart, and also the blood supply in the valves. Valves are different from coronary arteries. Coronary arteries are the channels for blood supply to the heart. To diagnose blockages inside that, we have to subject the patient to what is called a treadmill test, also commonly called a stress test, where we make the person walk on the treadmill and look for changes in the ECG. If the treadmill test shows that there are changes in the ECG, then we can start suspecting blockages at a very early stage. And if the treadmill test is positive, then we ask the patient to undergo further investigations. The standard investigation, of course, is coronary angiogram, where we inject dye into the heart and see the circulation and the blockages. But a very recent technology that has now come up to diagnose coronary artery disease is called a CT coronary angiography, where the same thing, the arteries of the heart are seen by way of a fast CT, 64 slice CT, and we can get very good images of the coronary artery disease to diagnose or rule out the blockages inside the heart. If you detect blockages in the angiogram, then what is to be done? Not every case which has blockages is subjected to surgery or procedures. Many a times, a good medical treatment, healthy lifestyle, and control of diabetes and hypertension is enough as a treatment for coronary artery disease. But if the blockages are severe, then we can subject the patient to procedures. The commonest procedure that's done is called the PTCA, or the angioplasty, where we put a balloon inside the artery and open up the blockage, and to make it remain open, we put what is called a stent, which is a metal tube inside the heart, and then the blockages are removed and the circulation is restored. Unfortunately, many patients come to us at a late stage where all the 3 arteries have developed blockages. If that happens, then the patient has to go for what is called coronary artery bypass surgery, where we put new tubes and the circulation is restored. But having said that, these are treatments which will make the patient adopt a normal lifestyle. Once he undergoes this procedure, he becomes practically normal. What are the symptoms of heart disease? The commonest symptom is chest pain, and the pain will be here behind the breastbone, and this is a crushing type of pain, particularly which comes on walking or climbing stairs. If you get this, please don't say that it is a gas problem or anything. Please approach your doctor and undergo these tests so that the blockages can be diagnosed at an early stage. Unfortunately, some people develop a heart attack as a first symptom of heart disease, but now we have got very good treatments for heart attacks. That is, we've got special medications which can bust the clot that forms inside the heart. Also, angioplasty and stenting can be done when patients come to us with heart attack at an early stage. So I'm till now talked about the various aspects of coronary artery disease. And you can realize that there's nothing to worry about if you come to a doctor at an early stage, adopt a healthy